My name is Ray Fassbender. I'm 75 years old. My introduction to chelation was the fact that I had heard about chelation 5 years before I had to have 8 bypass surgery in 1998. And after having it, having the open heart surgery, it was kind of intimated that had I had chelation therapy beforehand, I probably would have never had to have bypass 1, which is enough motivation to want you to kick yourself all around the room. But soon after, or January 1st of 99, I started to come to Dr. Joseph's. Because I had the open heart surgery, I had to have like 3 series of 10 or a total of 30 treatments. That's what he recommended after giving me the most complete physical that I have ever had, including hair samples. So anyway, between January 1st of 99 and April 30th of 99, I did 30 treatments. I was cleared to do one every other day, which some weeks I did Monday, Wednesday, and Friday, others not quite so often. But anyway, at the end of those 30 treatments, I had gotten off of all the cardiac medication that the cardiologist had put me on after the 8 bypasses. And I was drug-free, or prescription drug-free, for at least 10 years. I've gone through about 4 cardiologists. The most recent cardiologist was all bent out of shape that I wasn't on 4 different prescription drugs. He has put me on simvastatin and something else, an aspirin. But according to the government now, if I have the condition that I've had with the open heart surgery and all, that I'm supposed to be on 4 different prescription drugs. And of course my cardiologist has all been out of shape that I'm only on 2 and resisting being on those. But anyway, and he doesn't seem at all happy that at 75 years of age I come out with all these great tests. I have blood pressure the level that I had when I was a teenager, or maybe in my 20s. But when I found out that I needed to have a mitral valve change because it was leaking, I was feeling so good and all, and after the chelation therapy, my wife suggested I go back to the original surgeon that did the 8 bypasses, and I did after getting a heart catheterization, which shows that how your arteries and veins are inside, and it showed that I had absolutely no plaque buildup. Everything was flowing clean and green. So anyway, as soon as I gave him the heart catheterization test and all, he seemed eager to help me out by giving me the mitral valve change, which took place a year and a half ago. But anyway, I'm doing great, feeling great. My wife just took me to Vegas to celebrate my 75th, and we had a great 3 days, and here I am, and that pretty well brings you up to date, the short version.
Heard of a patient talk about this valve thing that you were just talking about?
Mitral valve?
Yeah, can you just mention what that is and why?
It's one of the valves in your heart. When I had the open heart surgery with the 8 bypasses, they opened up the sternum and did open heart surgery. The same doctor, as I said, went needing the mitral valve, which was leaking. They call it regurgitation. So he would perform less invasive surgery. He went in through my right side, deflated the right lung, went behind the heart, took the mitral valve out, put the new one in, which is a pig valve. You have a choice, a pig valve or a mechanical valve. Most people shy away from the mechanical valve because it constantly clicks and it's irritating. And a pig valve, well, I jokingly say if I oink in the morning, don't be alarmed, it's going to be a long day. But anyway, he went in through the back, and stitched it in, and then backed out, reinflated the lung and backed out. But I have surgery this way.
What do you mean 8 bypasses?
You have 11 cardiac arteries. I bypassed 8 of them. I had double, quadruple bypass, open heart bypass surgery. My doctor's never done 8 since. Never did 8 before. See this line in my leg? They started at my ankle, went all the way to my groin, and took that whole vein out to finance the 8 bypasses. And when they take that vein out, what I think is really unique, they take and they turn that vein inside out. Because when it's in your leg like this, the blood goes through and goes out. Well, they don't want to put it in your heart and have the blood go out, so they turn it inside out before the blood won't go out. And then they do 3 or so inch little strips, you know, but that vein financed the 8 bypass.